Welcome to the Roundtable on Health Promotion and Disease Prevention, with a particular focus on what can be done to encourage health systems to invest more intersectorally and create communities and environments that promote health. My name is Ingrid Stegman, and I'm Program Manager at EuroHealthNet. And I hope you saw the video this morning showcasing all some of the good practices that are out there, but that were transferred and implemented, but really a dynamic insight into these good practices. So I already thank some of my colleagues who are there on screen and on this panel for their work on producing those videos and engaging in this process. We didn't get a chance to discuss much after that, so that is what this roundtable is really about, and it's wonderful to have our panelists with us to provide their insights into this topic. Before I move on to the introductions, though, it would be very nice to hear a bit more or have a sense of the audience out there, to have a bit more engagement. That's difficult in the virtual world that we're in, but we do have some poll questions, just 2 short poll questions for our audience that we would like to ask you to respond to. David, can you pull up the first poll question, please? Will that work? Yes, there it is. So just to give us a sense of our participants out there and our audience, please let us know where you work and who you are. So it would be great if you could just find the category that best describes you and quickly tick on it. So again, we can have a sense of who's listening to us and engaging with us. Okay. And I hope. Okay. And do we have the results? Are coming? Here we go. So it does look like the majority of you are coming from national and regional institutes of health, which is very interesting to know. Some research institutes, not-for-profit organizations, and people working in ministries of health. So that's really interesting. And then we would like to ask you to respond to the next question. So there's one more poll. Do you believe governments are investing in health promotion and prevention to reduce the costs and consequences of chronic illness? Do you think there's sufficient investment? Yes, but it's still insufficient. Not really, but the situation is improving. Or no, there's not sufficient investment and the situation is not improving. It'd be very interesting to hear your views on that, particularly since most of you do seem to be coming from the health sector. Let's give you a little bit of time to respond. And let's see the results. That's quite interesting. Yes, but investments are still insufficient. So that is essentially the topic of this roundtable. I didn't want to mention it's strengthening health promotion systems, but that was jumping the gun a little bit. But I think there is a sense out there that there are things happening, but more can be done. So that's where our panelists can, with their experience in this field, can hopefully come in and build on some of the recommendations that and findings from CHRODIS Plus that we so quickly went over, but also their experiences in this field to tell us more about how they feel that this can be done. There is a question and answer box. If you hear something, if you have a question for the panelists, please do include that there. We don't have much time, so hopefully we can get to those questions, but it's anyway always good to know. There's also a chat box, so if you have more general comments or if you would like to share a link or some interesting material that's related to this topic, please use the chat box for that. So with no further ado, let's move on to the introductions. First, I'd like to introduce our panelists, Djuke van Dalen. And Djuke is from the Institute of Public Health and Environment in the Netherlands. Juka, can you briefly tell us a bit more about yourself and your role, substantial role in this, in CHRODIS Plus, and in particular this work package?
Yes, of course. Thank you, Ingrid, for the introduction. And I'm happy to share our lessons learned in this CHRODIS Plus. Well, I'm program manager at the RAVM. And my focus on my work and my team is on the best practice portal for health promotion intervention. And what we are doing, we are identifying best practices. We do the assessment of the best practices, the quality and effectiveness of the best practices. And more important, we try to improve the uptake of these best practices. What we have done also in this CHRODIS Plus with the practice jog. I work together with my colleagues Ledwien Lemmens and Marieke Hendricks and our co-task leader Edith Marosi from Hungary. And we identified in 20 practices, success factors, in 20 practices from 14 countries, success factors for intersectoral collaboration. And based on these practices, we formulate the recommendations for intersectoral collaboration, which you have seen for a part in the presentation of Ingrid. And I would like to recognize one of our colleagues, collaborating partner from Spain, Heather Rogers. She has done a lot of work in our practice, so I want to recognize her. And for my work, I want to tell you more about one practice we have presented, and that is the healthy overvecht in the Netherlands, of course. It's a local community program in the primary healthcare, working together with the social domain and the sport. And the reason why they started to work together is that primary healthcare felt a great deal of pressure and indicated that the situation was not sustainable. And there was a shared feeling of urgency, that they need to do something. And among all professionals and the municipalities and also the organization, they want to solve the problem together. And they defined a shared vision of how to solve their problem, and they agreed to all use the same interview model. And that shared interview model was very helpful in the collaboration between several partners. And it was also a bottom-up approach with support of the management. So I have told you a few of the success factors in one practice now. And now the project is implemented in 4 cities, such as Amsterdam and Rotterdam. And the practice is also mentioned in the financial guide, financial health promotion, the guide for financial health promotion of EuroHealthNet and the WHO. And in that way, I think it is an excellent practice for scaling up in Europe. Well, this is my first introduction. I hope I have not taken too much time.
Thank you. I think you can all take a lot of time with all the work and experience that you have in introducing yourselves, but that was very interesting. And indeed, this Healthy Adrecht program, I think in Utrecht, is a very interesting one in terms of really strengthening effectiveness and efficiency within health services, how different from people domains can really work together much more efficiently for the benefit of the patients and the users. So then I'd like to quickly move on and introduce Michele Cecchini. Please correct me in the pronunciations, all of you, in your names. But and we are very pleased that you joined us. You are from the head of health promotion, public health at the OECD. And we heard in the overview presentation by Taru Kovisko about how important cooperation with different organizations is, particularly the OECD, that's doing a lot of important work in this area in health promotion and public health. So please do tell us a bit more about yourself and some of this work and the links to the work that we're doing here in CHRODIS Plus. Michele.
Good morning, everyone. It's my pleasure to be with you. I'll be shorter. the role of OECD and why we are so pleased and so excited to have been partnering with CHRODIS for the last couple of years is in the raison d'etre of OECD. OECD, compared to other intergovernmental organizations, is strong on two very components. The first one is on transferring best practices across countries. This is really at the core of our activity, helping countries learn one from the other when there are things that work well. The second one is looking at issues with economic lens. And that's what we have been contributing and work with you with some pilot studies, Lithuania, Malta, Spain, just to mention a few. We are helping evaluating the economic impact of the pilots that have been implemented. I stop here for now, looking forward to the discussion.
Okay, thank you very much, Michele. And I have to say the other partners and I know each other through the work of CHRODIS Plus. We've met through this roundtable, but I hope it's okay that I also refer to you as Michele and use your first name to facilitate the discussions. Thank you. Then I'd like to move on to Gija Gundardotti. And again, my Icelandic is terrible, so please do pronounce your name correctly. But you are program manager for health promoting communities at the Directorate of Health in Iceland. We have heard your voice already in the video that we saw this morning, and when you presented the work of the health community promoting communities in Iceland, which is really at the forefront, I think, or the stellar example of how to engage in intersectoral work, because you're really trying to engage in all actors at the national and local level. But please do tell us more about this very exciting, but no doubt challenging work that you're involved in.
Thank you, Ingrid, for your nice introduction. I've been working for the Directorate of Health since 2005, first as project manager for physical activity, and now for some time also as program manager for the Health Promoting Community program. My previous experience includes being the head of Department Sport for All for the National Olympic and Sports Association of Iceland. And I'm currently a board member of the local level NGOs, the Reykjavik Sports Union. And along with other members of the Directorates of Health team, I've been leading the development of the Health Promoting Community program, including the formation and ongoing work of the program's intersectoral and high-level steering group and consultation platform. And as you heard before, involving 29 representatives from numerous ministries, governmental agencies, NGOs, and other national level stakeholders. Iceland is involved in the European Commission steering group on health promotion and disease prevention, and I've been a representative in that work. And I'm the coordinator for DOHI's participation in CHRODIS Plus, and I was also involved in previous CHRODIS and was so fortunate to have met many of you before. So yeah, and we have been implementing, as we said, selected part of JOG and also the multimodal training intervention compromise.
Okay, thank you very much, Gija. And then last but not least, I'd like to introduce Francisco Ruiz. Francisco, you're an expert in health promotion at the Andalusian Regional Ministry of Health and closely involved in various work strands in CHRODIS, certainly in this work strand on health promotion, and also responsible for that wonderful video we also saw on this program at the start of this conference. So Francisco, please tell us a bit more about yourself and your work in CHRODIS.
Thank you very much, Ingrid. Hello, everyone. I wanted to say it is an honor to be sharing another CHRODIS, a roundtable to be sharing with you all. I remember in the previous CHRODIS, we also you and I share a roundtable and led that very enriching experience. Well, I am I'm an advisor in the Health Promotion Service in the General Directorate of Public Health here in the Regional Ministry of Health in Andalusia, Spain. Andalusia is one of the largest regions in Spain. We have participated in the best practice portal at the national level, and we have ranked #1 at the national level. with a number of officially recognized good practices in health promotion. So it's an honor when I was called to participate in the first joint action that started in Madrid in 2014. I remember Yuka was also there. In Madrid, we started with the very first joint action CHRODIS, and that laid the basis of this new, very practical implementation of good practices in this joint action CHRODIS Plus. At the end of the previous joint action, I came up with the idea, and I proposed it, and the leaders there, they thought it was all right. So I came up with the idea to implement the good practice from Lombardy here in Andalusia, the workplace good practice, workplace health promotion practice. And then the adventure, this new adventure started. It's been really, really enriching, really learning experience for all of us. Many other colleagues jumped into the boat. So we not only participated in the health promotion section of the joint action CHRODIS, as we did in the previous one, but we also are involved in 4 sections. So right now, another colleague of mine is participating in WPH, and also in the evening, in the afternoon, another colleagues are preparing, are presenting. So for me, like Dia says, I also started here in the Regional Ministry of Health 15 years ago. In 2005, I was one of the co-authors of the comprehensive tobacco action plan, and I coordinated many of the strands of actions for about 7 years. And now I am involved in many different settings or health promotion, like workplaces and many others. So I don't want to steal any more time.
Well, thank you for that. I actually would want to stay with you because during the first overview presentation, there was a question that I think was directed directly at you, because it was about the workforce pilot in that presentation. And it was about how you measured behavior change towards healthy lifestyle within that project or the program, the transfer of the health promotion program from Lombardy to Andalusia. Were you able to measure behavior change? Or maybe you can, within the participants. Yes, yeah, because it was one of the questions from the previous section that we didn't get a chance to answer, and it was directly addressed at you. So immediately to bring in some audience questions.
All right.
Very briefly, but just to address that.
First of all, we have to say that the results are presented in a large report that will be hopefully make it public in the board website, and of course it will be published as well. So there will be all the details. But we did a pre and post implementation for the first period of pilot implementation experience. So it is only measuring the change for these 9 months. So we follow the questionnaires that Lombardy designed, and we measure at the beginning and we measure at the end of this first implementation, and then we compare with as a quasi-experimental design.
Okay.
So that's why we can.
So indeed, do check the reports, because there is a lot of evidence there, but again, only for 9 months. But it's again this important issue of evidence of effectiveness, and there is some evidence there in all of these transfers. But it's of course quite it was done over a short period of time. So to quickly move on with some more questions, we heard from the audience that they do feel that there is work going on, so some investment in health promotion and prevention, but this can be improved. So I'd like to hear your opinions about that. Is there currently, do you feel enough valuation or focus on this topic within your health systems or in your country? And what do you think are the main factors driving or impeding progress in this area? Michele, perhaps we could start with you.
Sure. Let me start by saying that probably I'm less optimistic than many of the persons that clicked on the yes, but things can go better. By looking at it from the OECD point of view, only 2.8% of total healthcare expenditure in EU countries is devoted to health promotion. Let's face it, this is the Cinderella of healthcare services. At least in European countries. If we look at the absolute number, we range from between a little bit more than €8 per capita in Romania to Sweden with 165 euros per capita. So the potential to increase investments in this area is enormous, and our work shows that it's a very good investment with a return on investment which outnumbers several times, in many cases, what is the investment. Now, let me also be a little bit provocative on the rest of my answer to this. There are multiple factors that justify why governments and in general European countries and the OECD countries invest relatively little in prevention. But there is one that is fundamental, is that when we talk about prevention, we are investing on healthy people. In majority of cases, there is also secondary and tertiary prevention, of course, but very often we are investing on healthy people that do not even know of the advantages of prevention. And if we do things properly, they will never know that the investment helped them have a healthy and long life. Therefore, there is clearly some gap in this, and we need to find ways to close these gaps. As OECD, with health economic analysis, we try to help countries close this gap. Over.
Okay. Well, that's very interesting that people don't even realize how much little is being spent, and perhaps if they realize more, they would want more investments if you can see the returns that this can bring. So maybe more to be done in advocacy, as we heard in the findings and the lessons learned. Gisha, would you like to come in on this and from your experience or the experience of the healthy promoting communities in Iceland?
Yeah, thank you. Well, I think it's always a room to do a better job, as people have said, but I think we are on the right track in Iceland. I think there's a growing understanding that public health, including health promotion and prevention, belongs on the agenda in all sectors, not only in health systems. And I think COVID-19 has really contributed to this understanding. And I think public health, including health promotion and disease prevention, is increasingly being addressed in policies, plans, and actions across sectors, both at national and local level. So we really see positive development. So, and I think in the governmental health policy to 2030, the important role of the primary healthcare centers in health promotion and disease prevention is emphasized, including having special units providing advice and support to individuals and groups regarding lifestyle and health. So that's a really positive development. And also I wanted to mention, we have a national e-health policy, and there has been rapid development with digital solutions, and we're very fortunate we had come a long way before then we suddenly have COVID-19, and that has really highlighted the importance of such development and accelerated. So, but examples of factor driving this development, I think, is more communication and understanding between sectors. Of course, we can always do more, but we have started this, and I think it's really helping. And as Mikael mentioned, of course, it's always also about money. So the growing availability of financial arguments is very important, but we still need more.
Okay, thank you. A lot of very important points that you touched on there. COVID-19, digital, the potential of the digital transformation, and communication again, and financial. Francisco, would you like to come in on this question of valuation and and the factors driving or impeding progress?
I'm very critical about the insufficient funding. The resources are not enough, and the mainstream culture of use for care and treatment, almost exclusively, are not compatible, are not coherent with the or even more and more evidence of the cost effectiveness of funding health promoting and preventing diseases interventions. So in our situation, in our region, and in Spain in general, we are facing this shortage of funding, I must say.
Okay, thank you. And Juka, but how is it from the perspective of the Netherlands? Do you feel enough is being invested in health promotion and prevention? No. Not sure if there's an issue with Juka's camera, or can you hear us, Juka? Okay, maybe we'll just move on and then come back to Juka on this point, since time is short for the roundtable, but we will hear from you in a little bit. Next question is around the lessons learned that were outlined in the overview presentation relating to intersectoral collaboration. Would you like to pick up on something, one of these points, the 7 points that were outlined, that you find particularly important or that struck you? Juka, are you back? Maybe not. Okay. Gija, would you like to start us off on this one? So any of the points, something in those 7 points that really struck you as important to achieve intersectoral collaboration?
I think they're all very helpful and relevant, but what I would like to especially mention is the connect collaboration goals with existing key policies while actively advocating for political support. And why? Understandably, all stakeholders consider what's in it for me before they invest their time and other resources. So according to our experience, framing the work in line with governmental priorities and main issues, including, for example, in Iceland, the social sustainable development goals has helped us to attract stakeholders and high-level stakeholders from different sectors to the table. So we thought they are a great window of opportunities, at least here in the context in Iceland. And establishing solid structure involving key stakeholders across sectors and level is a critical prerequisite for relevance, quality, and sustainability of the health promotion and prevention work. So this is absolutely the foundation to what we are doing.
Okay, thank you. And indeed, making that link to the Sustainable Development Goals is so important. And again, the work that you're doing in Iceland around this is maybe really spearheading this and worth for all others involved, other institutes and actors involved in this work, worth looking at how you're doing that and perhaps guiding the way because it can be a real avenue for change since there's so much potential promotion and well-being, and that's what the Sustainable Development Goals are really about, so linking that. So thank you for that. Michele, would you like to come in on this question about which of the 7 points really struck you as being important? And then we will turn to Juka, who's having technical problems in this technological world. We can all relate and sympathize. We'll get there.
Yes, I'm here, taking the floor. Thanks, Ingrid. There are, when it comes to transfer of good or best practices across countries, I think that out of the points that I saw this morning in the presentation, there are two that I would like to stress on my side. The first one is to link any process to existing policy goals. It is a very strong accelerator, in my view, to make things happen. it's very difficult to open a new priority, a new stream of priority, while making sure that there is a strong link with existing policy goals, help in identifying resources, help in finding open doors, and so on. The second one, which is closely linked to the first one, is to ensure sufficient resources to sustain collaboration. Finding resources is a key element to make things happen. But let me add also a third one from our perspective that perhaps we didn't stress that much when it comes to transferring rather than to implementing in the country, which is the careful evaluation of the interventions. And that's, I'm biased clearly in my point because this is what we are doing. We are helping and we are working together with you on this point. If you want to implement a policy and transfer it from country to the other, you need to show that the intervention you want to implement, or if it's a pilot to scale up, has a very good return on investment, is effective, is a cost-effective policy. Therefore, you need very careful evaluation following evidence-based methodologies. I stop here. Thanks.
Okay. Well, thank you indeed for stressing that point again on evaluation, which is, of course, which linked to effectiveness, proving effectiveness and cost effectiveness in the long run, which again is linked to advocacy. So it all gets, it's all tied together. But it's often indeed underestimated how many resources that takes, and it really needs to be built into to any kind of implementation processes. Francisco, would you like to also come in on this question? Of which of the 7 points really struck you as being one that you would like to pick up on and add to or emphasize?
Maybe Juka is already working. But,
indeed, yeah. Juka, please. Thank you, Francisco.
The lady, yes.
What do you want me to?
Wonderful.
Yeah. Ingrid, what do you want me to answer on this last point, the 7? What is the most important?
Let's go back to knowing where the Netherlands stands with respect to health promotion and disease prevention, and if you feel like there is enough evaluation in Holland for this. Maybe very briefly.
Yes,
I know you do a lot of work in intersectoral collaboration. You lend the work, so
yes.
If you can be brief on both points, that would be wonderful.
I tried to be brief. So I said yes and no. Our ministry has a lot of attention. It is spearheaded by our ministry. And one example, which is really a success, is our combined lifestyle intervention for overweight is now a part of our basic insurance package. And that's a huge success for the Netherlands. Prevention in our basis insurance basis package. And we have also a lot of agreements and national and local agreements for preventions, which are agreements with all kind of organizations, stakeholders. It's really an intersectoral agreement. So yes, but no. There is some budget, but it is still under the 3% of the total healthcare expenditure. So yes and no. So, and there is not so much work. It's coming, but there need to be done more work on health inequalities. There's the broad social determinants. It's difficult to address that in the whole government. They are talking about it, but investing, I'm not sure, but it will come. There is still. So that is, I think, enough for this. And one thing, the COVID-19 has stressed more awareness about the importance of lifestyle. So there is more support for attention for lifestyle. So maybe in the next government, we will have election. It will have effect. And then I go to I have to be sure, then I go to the 7 recommendations. And in my opinion, all they are important and they are independent. But I think a strong leader, a strong leader with a clear shared vision, how to solve the problem, and with good communication skill is the most important factor for success and long-term sustainability, because he can motivate all kind of stakeholders, organizations, governments, but can also take care for extra finance. So I think a highly in JOC was the success because of a highly motivated, strong leader, and of course the scientific evidence of JOC. And also in Hungary, the smoke-free legislation was the success of two important leaders. So I think that is very important.
Thank you for stressing that too. Obviously, we need leadership and leadership to come out of the health sector. So from ourselves and our audience members, people do have to step up to take that role too. So thank you. So maybe we can move on to the question on Gija. I'm not sure if you've addressed this particular question. Or if you'd like to, or we can move on to the question on the transfer of good practice and what role this can play to strengthening the field of health promotion and disease prevention. And perhaps here too, you can draw on the lessons learned. What would you like to stress to help strengthen this process, or the role of good practice and transferring good practice as a way to really strengthen this field in general? And Michele, I know the OECD is also doing some work in this area. If I know correctly, that you're also developing a database of good practices. So maybe first Michele, and then we can go back to Gija to answer this question around good practice and the role of identifying and implementing and transferring good practice to strengthen health promotion across Europe.
Sure, thanks, Ingrid. Well, rather than developing a database, what OECD does is to take the best practices that are currently in the databases, for example, the one posted by the European Commission, as well as working together with joint actions. Today, we are discussing about the CHRODIS Plus joint action, but starting from Thursday, there will be the kickoff a new joint action on best remap, for example, for policies on reformulation, marketing, and procurement. And again, OECD will be involved also in that specific piece of work. So we help countries, national initiatives, to add the economic aspect to the best practice evaluation. With the objective that then, both in terms of scaling up the best practice in the nation, in the country, and transferring the best practice to another country, can be supported by a strong economic case, which we hope, the European Commission that is co-founding all this work, hope that will help people like you, teams at the national level, to find the resources to continue working and upscaling the interventions that they are working on. So essentially, we are tools that you can use to go to your national level policymaker and saying, look, OECD says that if we continue doing this down the line, we can save this amount of money because of better care, because of better prevention, and so on. So our role is really to help you identifying what is the value of the work you're doing, number one. Number two, for countries that are interested in importing a best practice, our colleagues from Spain was mentioning about some of these examples. If a country, if a team needs help to make the case and to understand how a best practice can be moved from country A to country B, we are again very pleased to step in and support you in this piece of work. That's really what we do, and that's how we support these national initiatives. Over.
Okay. Gija, can I bring you in now to...
Yeah, thank you. It's a very valuable contribution from the OECD. It's always it's a specialized knowledge, the economic evaluation. So it's very valuable. But what I wanted to mention is the transfer of good practices. Obviously, is very helpful to learn from others, but the literature and experience exists absolutely. But for better results in sustainability, or the best results in sustainability, the starting point has to be the existing needs in each country, and realistic needs, and also the available resources and so on. And as has been previously mentioned, if it's possible to build on existing work and build the work from there. So, and therefore this agreement between the good practice owner and the implementer is so important to clear that, because in the end, as from our experience, and of course it depends on what you're doing, but it's not, the context is so different. So you have different needs, so you really need different recipes. So it's a fusion cooking. So, but the starting point has to be the needs country.
Okay. Thank you for that. But again, because I think that's a very important point, that it's not just about transferring what's good, it's about filling a need, and there has to be a demand for a particular good practice. So it's really calibrating what those priorities are and where the needs are to make sure that fit, and fitting that transfer, that intervention, perhaps adapting it to address that need, if there's agreement between the two parties. Okay, I see we have very little time left. I did feel like we had quite a short amount of time for this roundtable. I think it would have been interesting, Duka, you mentioned inequalities, and that's such an important line throughout this work too, because as we know, so many interventions might actually widen health inequality gaps, because they are taken up by people who would already perhaps adopt healthy lifestyles. And how do I identify and target interventions to those in most needs? I don't think we really have time to go into that now, but I have just a final question to all panelists. Maybe that's something that you can briefly pick up on as a theme. But in that final question, what one key thing or action would you strengthen in the field of health promotion? If you could strengthen, if you could point to one thing to strengthen health promotion and disease prevention in Europe, an action that can be taken, what would this be in your view? Francisco, we haven't heard from you. Let's, for a while, let's start with you.
I wanted to go on with what Duka already also pointed out, the topic right now, the COVID-19. So I think health promotion can strengthen the prevention measures, and it is very important in these special moments to empower the society, to empower the citizens. And that's exactly what the Andalusian Regional Ministry of Health, in particular the General Director of Public Health, is going to invest. It's going to invest in capitalizing the networks, the resources we already have, the knowledge, the expertise we already have in health promotion, and use it to empower the citizens, to bring them, or to bring them some help in the way or by means of health promotion measure. So in that way, I wanted to emphasize two things. One is to increase the use of health promotion and disease prevention best practice. The knowledge is already there, so let's use it. And the other one, let's use more validated tools and a systematic framework, such as the CHRODIS plus implementation strategy, that is going to be of help for all of us, because we are going to generate a stronger evidence-based results for all of us to make, to strengthen, to emphasize the importance of these health promotion and disease prevention measures. That's all.
Okay. Thank you. And Duca, would you like to come in with a final word on one key action?
I'm relating it also to our work in CHRODIS and what we have learned in CHRODIS. And what is very important is the learning communities. And so we need support and finance of administrative support to maintain these health promotion learning communities. So I think it's also in the Netherlands, it is very important to have the learning communities. Together we come to, also with the health inequalities, we have to do it together. And I was struck by the presentation of the health minister of Finland. She said, and I agree with that, we need structural permanent structures for financial and personal resources. That is also very important. I think I like to stay with that.
Okay, thank you. And Michele, would you like to come in on one key action to strengthen health promotion across Europe?
In a text message, I think implement the 7 points that CHRODIS Plus has identified. That's the way of success. That's my very strong motivation. I think you did a great job. You came out with very strong messages. You're showing that it is possible to implement and scale up this type of policies. Hopefully we'll support you and we'll come up with numbers that make the case even further, but implement the 7 points.
Wonderful to hear those points validated. Thank you. And please look at them. And Gija, your final word, strengthening health promotion, key action needed.
Well, I agree with all my colleagues here, but I wanted to emphasize the structure. We need structure also for health promotion and prevention, not only in the healthcare system, but also intersectional structure at national level, in regional level if relevant, and at local level. And then to strengthen those structure and, have them active communities. And as Duca said, and work on strengthening those structure. And then they are the starting point for further interventions and work.
Okay. Well, I know we've gone a little bit over time, just 5 minutes, but thank you all for bearing with me. I think you'll agree it's just it's worth the extra minutes to listen to our panelists and to hear about what can be done to strengthen health promotions. I think we have many good ideas. It'll take too long to summarize, and we could have gone on longer. But really about communications and communicating the benefits, empowering people, providing the structures, finding the resources, and really producing and advocating with or demonstrating the evidence of these kind of good practices, because at the end of the day, it's all about people's well-being. And the COVID pandemic that we all find ourselves in, this is the reality that we're in. It's almost cliche, but it has made us realize the importance of health, as we know, the importance of lifestyles in health, and the fact that more people who have underlying chronic diseases are much more vulnerable to catching and dying from the disease. This is really an opportunity to invest more, and I think people will see the benefits of that, and we see the wonderful kind of initiatives out there that we saw this morning. Who doesn't want to take part in these kind of things? So thank you all very much for your time and your wonderful insights and contributions. And I hope we're all in this together to push them forward and create more valuation, even more valuation, and make health systems also more health promoting. Okay, thank you very much. And enjoy your lunch, your shorter, good lunch. Thank you. Bye-bye.